Yes, folate is one of the best things you can take in pregnancy, but more isn't ultimately safer. So many of us treat prenatals like the more you take, the more of it you'll absorb. It feels responsible, and for the big thing folate does, preventing neural tube defects, it is genuinely one of the best things you can do. But there's a number here worth knowing, so stay with me. A cohort study just found that sustained high-dose folic acid was linked to roughly double the risk of gestational diabetes compared with the standard 400 microgram dose. Now, this is an association. It's not proof that folate causes it, and it needs replicating before anyone changes the guidelines. But it's a real signal, and it quietly challenges the more is better assumption most of us are running on. The standard 400 to 500 micrograms is the dose the evidence actually supports for most women. Higher doses are for specific medical reasons decided with your doctor, not a default you've chosen because it feels safer. So here's what to do. Read the folate number on your prenatal. Sometimes it's presented as MTHF, which I hope it is. Sometimes it's presented as folic acid. If you're on a high dose one, and I'm talking 800 micrograms, which is typically the equivalent of 2 to 3 times what's in a standard prenatal, don't stop. Just ask your GP at your next visit whether you actually need that dose or whether standard is more right for you. More is ultimately not safer, but the right dose is. If you want to stay up to date with the latest research in the pregnancy space, follow Expecting Mums Australia. My sole purpose here is to give you only the most accurate and latest information so that you can make informed decisions about your pregnancy.